Hello, Kevin Wee here again. This is a video for my Cert 3 and 4 on fitness. And today we're talking about special populations, patients with a knee injury, and some of the modifications and exercises that clients can perform if they have an injury of that sort. So awkward movements, falls and collisions, sudden twists, excessive force or overuse can result in a knee injury. And injuries to the joint and the supporting structures surrounding it. So common knee injuries include ligament, tendon, cartilage tears as well. So prompt medical attention for any knee injury increases the chance of a full recovery. And treatment options include physiotherapy, arthroscopic surgery, and or open surgery. So the knee joint is held together by tough bands of connected tissue called ligaments. And sudden twists or excessive forces on the knee joint, commonly caused by repeated jumping or coming to a rapid halt while running, can stretch ligaments beyond their capacity. Torn ligaments can bleed into the knee and typically cause swelling, pain, and joint laxity. The anterior cruciate ligament, or ACL, situated in the center of the joint, is the knee ligament commonly injured. A ruptured ACL does not heal by itself and may require reconstructive surgery. So tendon tears, so the muscles are anchored to the joints with tendons. Overstretched tendons can tear and bleed, but these injuries tend to heal by themselves without the need for surgery. And then you've got cartilage tears, where the knee joint is bolstered on both sides by additional stripes of cartilage called menisci, or semilunar cartilages. One of the most common knee injuries is a torn or split meniscus. Severe impact or twisting, especially during weight-bearing exercises, can tear this cartilage. Tears of the meniscus can also occur in older people due to wear and tear. Symptoms include swelling, pain, and the inability to straighten the leg. The damaged cartilage can be surgically trimmed or even removed without causing any joint instability. So just because you have bad knees doesn't mean you need to stop exercising. In fact, certain exercises, such as step exercises or exercise with a resistant band, can be beneficial for people with bad knees. So low impact exercise such as cycling or even walking may help your knee ligaments be flexible and supple. So, however, some types of exercise are off limits because they can cause more harm than good, and they may exacerbate your condition, i.e., that is, make it worse. So squats, should you do them, should you not do them? Well, deep squats with a knee injury involve excessive flexing, are generally not recommended for people with bad knees. Deep squats involve an extreme bending motion and your knees end up supporting most of your weight, which could potentially exacerbate pain because of placing an inordinate amount of stress on your knee. So one of the recommendations, if you still want to squat, is squatting to a box. Make sure that the box is at a level where it's not too deep where you start feeling pain in the knee joint. Another exercise that's contraindicated is jumping. So jumping is a high impact activity that shocks your knee joint, shocks your knee joint and places stress on the knee when you land. So anything that involves jumping, known as plyometrics, including jumping up repeatedly to shoot a basket in playing basketball, and these activities place a force of 2 or 3 times your body weight on your knees, so potentially increasing your chance of injury and pain. Other exercise you can do instead of that is lower impact activities such as swimming and cycling are more suitable for clients with knee injury. The other exercise which is contraindicated, it would be running, because running is actually high impact, and there's a lot of shock that's placed on your joints, and there's a lot of stress on your joints too. However, running is not completely prohibited for bad knees either. So it really depends on the surface that you're looking to run on. And that actually makes a big difference. So running on pavement is not advisable because the hard impact can make your knees actually worse. However, running on dirt tracks, running uphill or on a level surface as opposed to downhill can be beneficial for your fitness and continue to keep moving. And making sure that you have properly fitting running shoes is advisable for anybody with knee issues. So really just staying away from anything, also sports with directional changes, sudden directional changes. So try to avoid these. So anything like soccer, volleyball, basketball, skiing, anything that requires you to change directions quickly should be avoided. But apart from that, there's a lot of exercises that you can do, even if you have a knee injury, that can help you to keep fit.